Hey there, I'm back with another video and we are going to do the upper limb today really quick. Let's just go ahead. Alright, the first thing is arm pain, and the technique to remember the differential diagnosis for arm pain is think about the shoulder joint, and a joint is made up of bones, muscles, and tendons, right? So, we are going to approach the differential diagnosis if there is something wrong with the bone or the tendons or the muscles in the joint. So, the first one there is bones and joints. So, it can be a fracture or dislocation. Then, domestic violence and elder abuse. This can be the cause pertaining to bones and or joint, fracture, dislocation, or trauma. The next one is pertaining to muscles and tendons. Muscle strain, it is very common, especially look for if the person is a sports person, then muscle strain, rotator cuff tear can be one of the reasons for arm pain. And then tendinitis, this is very important, especially in shoulder, because we have two tendons coming over there. One is the biceps and one is the supraspinatus. So that's the reason why we have to think about tendinitis here, and it can be one of the most common or contributing causes of arm pain. Next, think about systemic symptoms, and the diagram for that is here. There you go. The systemic symptoms, it can be MI, which can be the pain radiating to the left side from the heart. So this is the pain radiating from the left side to the heart. It can be MI. And also think about GERD if you're thinking about systemic symptoms. Even if it's not the cause, it can be one of the pertinent negatives. So this is the esophagus, this orange tube over here. So pain radiating from either the heart or the orange tube over here, it can be MI or GERD. Next, think about GIT, okay? There is the liver in this quadrant and there is the spleen in this quadrant. So we have the concept of referred pain, right? So the referred pain of the gallbladder can go to the right shoulder tip, and the spleen in trauma can go to the left shoulder tip. So you can get a case where there is history of trauma or a motor vehicle accident and the patient is coming in with arm pain, and he's also complaining that of shortness of breath. He can't breathe properly, he can't take deep breaths, or he can complain of left upper quadrant pain and then left shoulder tip pain. So it can be a splenic rupture. So this is the systemic causes of arm pain. And when we come to the questions, what we are going to ask, it's the same for all musculoskeletal systems. It's warmth, redness, swelling, stiffness, popping. Do you have any weakness, numbness, tingling, or deformity? That is important over here. Did you notice any loss of contour in your shoulder? So deformity is one extra thing that we ask over here. And when it comes to review of symptoms, it is the same mnemonic. You can just follow the review of symptoms mnemonic, which we did in our first general mnemonic video. That is THENFRPUBCS. Okay, that is the mnemonic. And please remember to replace I with either insect bite. For musculoskeletal system, insect bite is very important. We have to ask because it could be Lyme, especially if it's knee pain. Next, wrist pain. So wrist pain is very simple. So we have the joints over here: interphalangeal, metacarpophalangeal, and wrist. And the first thing when we think about interphalangeal or metacarpophalangeal joints is rheumatoid arthritis. So rheumatoid arthritis is very important when it comes to wrist pain. That's the first thing we think about. And the most important point that I have to remember is the differential diagnosis of RA is SLE, because the systemic symptoms are common for both. And the joint symptoms of RA overlap with that of osteoarthritis. So when we think about rheumatoid arthritis, we have to think about SLE in terms of systemic symptoms and osteoarthritis in terms of joints. So it's very important for us as doctors to differentiate between RA and OA on one side and RA and SLE on other side. All right, so let's first talk about the interphalangeal joint, and the first diagnosis over here is SLE. Especially if it's a female patient aged between 28 to 35 years, please ask for anorexia, fatigue, hair loss, rash, and female patient history of abortions is very important. And Raynaud's, like as you can see over here, this is discoloration of fingers that can points towards Raynaud's, and you can type it under your supportive diagnosis for SLE. Like I said, the differential diagnosis of SLE is RA because the systemic symptoms overlap with SLE because of the systemic manifestations. And at the interphalangeal joint, you have one more diagnosis that is nothing but psoriasis. And what are the supporting points? It can be a scaly salmon pink rash on extensor surfaces of elbows and knees. Okay, so that is psoriasis. Now come to the metacarpophalangeal joints. The diagnosis is rheumatoid arthritis. So there is no surprise over here. We have to ask about morning stiffness for rheumatoid arthritis. It has symmetric joint involvement, and we have to also ask about deformity. Like I said, we ask about deformity over here for wrist. It is very important. Two things very important when the patient present with wrist pain are deformity and also weakness, numbness and tingling. So in upper limb, weakness, numbness and tingling is very important. And then deformity, we know swan neck, bottom-ear and ulnar deviation of the hand are the deformities of RA. And swelling is very important for osteoarthritis. We have Heberden's nodules over there and Bouchard nodules for osteoarthritis. So the differential diagnosis for RA is OA, especially if left knee is involved and it's red and swollen. Next, when it comes to the wrist, we have carpal tunnel syndrome. In carpal tunnel syndrome, the supporting positives can be there's weakness, numbness, and tingling, and there's burning pain in the first, second, and third fingers, which is worst at night and decreases on shaking. And profession or occupation is very important. It can be a software. And then there can be decurrent synovitis. And for decurrent synovitis, the test we should do is Finkelstein test. Look out for the profession. He can be a golfer or new mom. And an honorary mention. Honorary mention is for elbow pain. The only diagnosis over here is tennis elbow. Here the grip is impaired and there's tenderness over the lateral epicondyle, and the test we have to do is Corzine test, which is very important. Next, moving on towards the neck and back pain. Hopefully this is the last part of the musculoskeletal system. Neck and back pain. All right, so think about the bones. Then think about, this is the first thing. This is the first thing that we think about when it comes to neck and back pain. Bones and intervertebral discs. The second one, do they have weakness, numbness and tingling, or do they not have weakness, numbness and tingling? If they have weakness, numbness and tingling, it means that the nerves are involved. So it can be involved because of the bone or because of there's a problem in the disc. If the disc has a problem, then the diagnosis is disc herniation and spondylosis. Disc herniation and spondylosis. If the bone is involved, then it can be a fracture or osteoarthritis or osteoporosis. Okay, so when it comes to the bone, fracture, osteoarthritis or osteoporosis. When it comes to the disc, it is either disc herniation or spondylosis. Okay, now come to this part where they don't have any weakness, numbness and tingling. All right, here, this is the bone. Okay, this is the bone. If there is a problem in the bone, if the problem is coming from up or if the problem is coming from down, this is how we have to think about. If the problem is in the bone, it is multiple myeloma. If the problem is coming from up, it is meningitis. If the problem is coming from down, it is metastatic cancer. Why I have put it down is because prostate is down there, right? And in men, the most common mets is from the prostate. That's the reason why I have kept it from down and the prostate is down there, just for ease of remembrance. And muscle strain, finally. It can be muscle strain, especially when the person is giving the history of lifting heavy weights. We can just type it under our differential diagnosis. So I really hope that this will make things simple for you. And when we think about systemic symptoms, what can be the causes? It is ankylosing spondylosis, RA and SLE that go hand in hand, fibromyalgia and chronic fatigue syndrome. If it's a woman, then it's fibromyalgia. If it's a male, then chronic fatigue syndrome. Okay, and the questions that we are going to ask over here are just go from top to bottom. We have to go from top to bottom to remember the questions. Suppose it's neck pain, then breathing problems also come. Suppose the patient is presenting with back pain, then think about the back. Have you lifted any weights? Have you lifted any heavy weights? Then go down. Do you have any incompetence or impotence problems? Then, has it affected your gait? Have you noticed any changes in the way you walk? If there is neck pain, then start from the top. Do you have any breathing problems? That's it. This sums up neck and back pain for us. They're very simple. The causes are almost the same for both. I really want to tell you that for musculoskeletal system, there are a few points that you have to remember. The first thing is the attitude of the limb. This is very important and it can be very scoring if you can type the attitude of the limb, like Faber, flexion, abduction, externally rotated on inspection. The limb is in this position, or farther flexed, adducted, and internally rotated. The limb is in that position. It's very good if we can type this. And under diagnosis, we should always consider osteoarthritis or osteoporosis and RA. Like we said, RA goes hand in hand with SLE on one side and then OA on the other side. So when we think about OA and RA, then trauma. Trauma is very important. And then we have D, E, and F. Okay. D is for domestic violence in a female, elder abuse, factitious. Factitious, it's very, very important. Supposing a person wants leave from work and he's just acting that he wants back pain. So it can be a factitious disorder. These are very important to remember for any joint or limb pain. I hope you're benefited from this video. All the very best for your exams. Thank you.